Let me ask you a question from Donna Marks. She sent it in at facebook.com/democracynow. She asked, I'd like to know why Mr. Potter isn't naming names of the people responsible at CIGNA for denying claims that kill people. Why is he not shaming people the way he was shamed? I mean, that turned you around. You have Elizabeth Benjamin saying P-O-T-T-E-R.
Yeah. I talk about the system, and there are medical directors in every company, and that's the important point here. Nataline, it might have been different had she been covered by Aetna. It might not have been. It might have been different if she had been covered by United. We'll never know what happened to her. These are not faceless people necessarily, but they are part of a system. They are employed by corporations that make life and death decisions. It is the CEOs, in my opinion, who are ultimately responsible for this. They are the ones who are accountable. The only accountability that they have, quite frankly, in our current system is to the investors and the Wall Street analysts who cover the industry. That is who they answer to, and those, in my opinion, are the people who really need to be held to accountability in this country.
What about the provisions in the healthcare legislation that the healthcare company will oppose? They love the mandate. Everyone's got to buy their health insurance. I mean, there are many single-payer activists who are enraged by what Obama did. So in an odd way, they join with the Tea Party Republicans in saying that Obama has destroyed a chance of getting truly affordable health care, that this is insanely expensive because he preserved the insurance industry, the very industry you're speaking out against.
It is really a predicament that we found ourselves in. I think that the president felt that he had no alternative but to proceed the way he did because the insurance industry is so incredibly influential and powerful. It spends a big chunk of our premium dollars every year in campaign contributions and in deceptive advertising campaigns and PR campaigns. So they are unbelievably influential on Capitol Hill. The reason there was no discussion of a single-payer system is because of the influence and power of the insurance industry. And I ultimately said that I think it was important for Congress to go ahead and enact this, despite its many flaws and shortcomings. And
not only isn't it single-payer, it doesn't even have a public option.
It doesn't. It doesn't. And I think that the people who were advocating for a single-payer system or liberals were right to be outraged. But we live in a political world, and we've been trying to get some kind of meaningful reform enacted in this country for 100 years, as I write in my book. And every time we've come close, it has been defeated because of activities like the insurance industry. It's not just been the insurance industry in years past. The AMA has played key roles in many times in the past in killing legislation.
How do the companies conspire with the AMA? How does it actually work inside?
Back during the Clinton years, I was involved in the effort to kill, regrettably, the Clinton health care plan. It was no great legislation compared to what we really need, but it was a real serious attempt at reform. But the doctors didn't like it, the hospitals didn't like it, and the insurance companies didn't like it. They disliked it for different reasons, but the thing they had in common was that there was at least something they didn't like about it. So this is this organization in Washington called the Healthcare Leadership Council, and I went to many meetings of this organization. It was an umbrella organization that the sole purpose was, at that time, to kill the Clinton plan. And the AMA had a representative there, and so did the medical device manufacturers and all the other big insurers. And you conspire in that kind of an organization that is outside of the traditional roles of your trade association, where these interests can come together and work to defeat something. It's easier to defeat something than it is to support something and get something passed.
Amazingly, more and more doctors, in fact, I think in some polls a majority of doctors are for single-payer. They have really turned around, and like in many situations, their own association ends up trailing behind, not representing them.
Exactly right. And the AMA ultimately came to support this legislation, and again, in years past, they've really been adamant opponents of reform. But you're right. Doctors are becoming all too aware of what it is like to try to practice medicine and do the right thing for patients in a system that is dominated by insurance companies.
How does CIGNA, Humana, deal with organizations like Physicians for a National Health Program? These are the big single-payer activists in the United States. Are there dirty tricks campaigns against them?
Well, there are to a certain extent, but the big objective here is to make the whole concept of single-payer unpleasant, or at least to demean the idea of it, to call it socialized medicine or government-controlled health care.
So do you have talking points?
Oh, absolutely.
Whenever you refer to that, you say socialized medicine?
Exactly. It's when you say something like that, it's not true, but it doesn't have to be true. You just say it, and you say it over and over and over again. You get your allies to say it over and over again to the point that Americans believe it. And we saw that happening during this recent campaign. They were calling this legislation that was passed a government takeover of the healthcare system. It certainly was not.
I mean, you have this situation where so many people are being foreclosed on, they're losing their houses, they're losing their jobs, and then you drop in, well, it's health care that's sucking up all the money. People don't even realize the health care doesn't go into effect, and maybe that was part of Obama's problem until 2014, that it isn't being paid for right now, and yet they think, well, I'm not experiencing anything good in health care, so this is just a fraudulent system that's taking all our money and our jobs.
Yeah, I can understand why people can be so easily persuaded that this is bad legislation. It already is beginning to help people. There are a number of consumer protections that are now in effect, but people just are not aware of them because they're not seeing it right now. And
the
you're right.
Obama administration seems to be afraid to tout it because it's become such a flashpoint.
Which is just maddening. During the whole debate, I kept wondering when the Obama administration was really going to be rolling out its sophisticated communications techniques to explain this legislation.
Like maybe a ceremony on the day that kids could stay on their parents' health care. This was about a month ago, right? Until they're 26.
Yeah.
I saw hardly any mention of this.
I know. They seem to have lost the ability to communicate. Senator Claire McCaskill was quoted, and I saw her being interviewed the day the Senate was to vote on its version of the legislation. Why they found themselves voting on a bill that didn't have a public option. And she said, well, we lost the messaging battle. And it's very true. The advocates of reform just were so outfoxed constantly by opponents of reform.
The polls are amazing. The poll numbers, Kaiser Family Foundation in August, eliminating pre-existing condition exclusions for kids, 72% in favor. Providing tax credits to small businesses, 71% in favor. Limiting insurance companies from withdrawing coverage, 68% in favor. Closing the Medicare prescription drug donut hole, 64% in favor. They have the whole country behind them.
Right.
Okay, let's go to Sicko. Let's go to the Academy Award-winning filmmaker Michael Moore's film, Sicko.
We got an issue in America. Too many good docs are getting out of business. Too many OBGYNs aren't able to practice their love with women all across this country.
When Michael Moore decided to make a movie on the healthcare industry, top-level executives were on the defensive. What were they hiding?
That's not on, right?
No.
Okay.
The intent is to maximize profits.
If you denied more people health care, you got a bonus.
When you don't spend money on somebody, it's a savings to the company.
I want America to have the finest health care in the world.
4 health care lobbyists for every member of Congress. Here's what it costs to buy these men, and this woman, this guy, and this guy. And the United States slipped to 37 in health care around the world, just slightly ahead of Slovenia.
I denied a man a necessary operation and thus caused his death. This secured my reputation, and it ensured my continued advancement in the healthcare field.
In the world's richest country.
I work 3 jobs.
You work 3 jobs?
Yes.
Uniquely American, isn't it? I mean, that is fantastic.
Laughter isn't the best medicine.
I get a bill from my insurance company telling me that the ambulance ride wasn't pre-approved. I don't know when I was supposed to pre-approve it. After I gained consciousness in the car, before I got in the ambulance.
It's the only medicine.
There was actually one place on American soil that had free universal health care.
Which way to Guantanamo Bay?
Detainees representing a threat to our national security are given access to top-notch medical facilities.
Permission to enter. I have 3 9/11 rescue workers.
They just want some medical attention, the same kind that the evildoers are getting.
Hello?
Michael Moore's Sicko.
All right, there you have it, the trailer for Sicko. It comes out. What does CIGNA do? You were the spokesperson. Were you the spokesperson at the time?
I was,
You
yeah.
were.
Yeah.
So how'd you prepare for this?
Well, we were afraid as the movie was being made that Michael Moore would do ambush interviews, as he's done in a lot of his movies in the past. So we lived in fear, I did, especially, that my CEO would be getting out of his limousine at some point and there would be Michael Moore with a camera in his face. So one of the things we had to do was to make sure that we media trained our CEO and other executives so that they wouldn't look like a deer caught in the headlights, if we could do that at all.
What'd you tell your CEO? Wait, tell me his name again?
Ed Henway.
What'd you tell Ed?
Well, just be pleasant. Don't run and hide, and just shake his hand and say, "Hi, I understand you're the Hollywood movie maker, and I've heard of you, and I don't have time to talk to you right now. So if you'll call Wendell Potter, I'm sure he can arrange for us to talk at some later time."
Then it wouldn't have just been the people of New York calling you, but people all over the country calling Wendell Potter.
But I was willing to take the bullet because I was,
And what were you going to say?
I would say, not a chance. You're not going to get anywhere close to the CEO.
No, but what was your message on Sicko?
The message on Sicko was that this was Michael Moore's vision for America was to lead us into socialized medicine. We went back to those points again. We wanted to make sure that people were afraid of any other kind of system that would have more government regulation and in which people had universal care.
Did you work with other insurance companies in dealing with Michael Moore?
Absolutely. We heard about Michael Moore starting this movie when he announced it, I think, in 2004. And as the movie was being made, we didn't really know exactly how we would be portrayed in the movie. But when the movie premiered at the Cannes Film Festival in 2007, we, as the industry trade association, sent a staff member to the Riviera to go to the movie, to be among the first to see it, and then report back via conference call who was in the movie, how we were being portrayed, and we, from that moment on, developed a very, very sophisticated communications campaign.
Can you say what it was in 5 seconds? Because we're just about out of time. The strategy.
To make sure that people saw him as a Marxist, as a socialist, and that he was going to be destroying the American dream.
Wendell Potter, are you for socialized medicine now?
I think that we need to have a system in which everyone is covered. If you call that socialism, so be it.
Wendell Potter, former executive, former chief spokesperson for CIGNA and Humana. His book is called Deadly Spin. An insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. I'm Amy Goodman. Thanks so much for joining us.